What does brain death mean? Brain death is a legal definition of death. It is the complete stopping of brain function and cannot be reversed. It means that because of extreme and serious trauma or injury to the brain, the body's blood supply to the brain is blocked and the brain dies. Brain death is death. It is permanent. It cannot be reversed. How it is decided that an individual is brain dead? Well, it is determined by a physician by doing neurological examinations. The neurological examinations must state that the brain functions are completely stopped and it is irreversible. It can also be done by tracking EEG waves, but there are two criteria for doing this process. One, the patient should have a normal temperature and the patient should be free of drugs that mask the brain functions. A radionucleotide cerebral blood flow scan that shows complete absence of intracranial blood flow must be considered with other examinations. Temporary swelling of the brain, particularly within the first 72 hours, can lead to a false positive test on a patient that may recover with more time. Confirmatory testing of brain death is required only under the age of 1. Also, in some conditions like severe facial trauma, where determination of brainstem reflexes will be difficult, pre-existing pupillary abnormalities, and patients with severe sleep apnea and or pulmonary disease. Confirmatory tests include cerebral angiography, cerebral encephalography, transcranial Doppler ultrasonography, and cerebral scintigraphy. Cerebral angiography is considered the most sensitive confirmatory test in the determination of brain death. Normally, when a patient is brain dead, his heart functions will not stop immediately. His heart functions as long as there is oxygen supply. To do this, the patient is placed on the ventilator. This is a machine which is needed because the brain can no longer send signals telling the body to breathe. Special medications to help maintain blood pressure and other body functions may also be given. During the brain death testing, the ventilator and medications continue, but they do not affect the result of the testing.